Hey everyone, this is Dr. Wilmerillo again. In this second part video series, we're going to talk about how we diagnose headaches or migraines in our office. One of the big things when we're trying to figure out if a patient has headaches or migraines, if they're suffering from it, is getting a good history. I think with any medical provider, getting a good thorough history is going to help you lead you in the right direction to find out what diagnosis this patient has or condition. So the first type of headache that we tend to see quite often is tension or cervicogenic headaches. Usually that's due to cause by many factors, mostly in the suboccipital muscles. They get really tight, and if they get really tight back here, this can cause a lot of headaches onto a patient. Posture is a big one. So nowadays, a lot of us are working from home, or we're always on our phones, so we're constantly in this position or like this. That can cause a lot of tension in the neck. If you have tight SCMs, that tends to flare up and give you headaches behind the ears, sometimes on the side of the head. If you have a history of grinding your teeth at night and you don't wear a mouth guard, that can cause pain in the TMJ, which can trigger your headaches. Another big one that we see in the office, especially, is when there's a nerve here that comes out called the suboccipital nerve. And around the occipital nerve, there is a muscle called the superior oblique. When that gets really tight, we tend to work on the back of that muscle to try to relieve the tension in the muscle to help take tension off the nerve. Now, another thing that we see quite a bit is a levator trigger point that causes headaches. So having pain back here and it comes all the way upwards. Usually that's due to, again, bad posture. Now, the second type of headache we're going to talk about today is called vascular neurological, which can be caused due to if you have a high history of high blood pressure. That can sometimes cause headaches, and sometimes that can be due to stress. Another one is having decreased blood flow to the brain. So if your blood pressure is low, sometimes that can cause a headache as well. Or if you have a history of vasodilation condition, that's some sort of condition you have in your medical history, that's important to know. The third type of headache we see is a metabolic type of headache, whether it's caused by if you're diabetic, you're not able to absorb the glucose, and your brain, its main fuel source is sugar, glucose. So if you're not able to absorb glucose, your brain's not getting that nutrients that it needs, so that can cause you a headache, or just being dehydrated. And the fourth one is caused due to miscellaneous, meaning that it's due to a sinus infection. If it's that time of the month, that can cause headaches as well. And now in our next video, we're going to talk about how we treat these headaches in our office using our soft tissue technique called ART, active release technique, and how chiropractic adjustments can help relieve some of your symptoms. So look forward to seeing you guys next week on our four-part video series. Take care. Have a great week.